Planning for your bundle of joy can be both exciting and yet intimidating, but Florida Hospital is here to help in our special segment called Little Inspirations. Today, Dr. Marion Sampson joins us from Florida Hospital, Zephyr Hills, to help answer questions about pre-pregnancy health and planning. Good morning. How are you?
Good morning. I'm fantastic. Thank you for having me.
Well, thank you for being here. And I like that we're talking about pre-pregnancy because so many couples know they want to have children. So what do they need to start doing right away?
One of the most important things they can do is to plan a visit for preconception care with the obstetrician gynecologist. A lot of people don't think about that in terms of evaluating your lifestyle, evaluating your diet, even evaluating your family history or history from a previous pregnancy can be very important and helpful for a future pregnancy.
I was going to say, what are some of the things that you look for during that time? What's some of the advice that you do end up giving patients that helps them when they do get pregnant?
Well, one of the things is just to evaluate your general health. If you have a pre-existing condition like high blood pressure or something dealing with a previous pregnancy like gestational diabetes, those are things that would need to be evaluated ahead of time so that we can have the most healthy outcome for you and the baby.
And I've heard that maybe when the prenatal vitamins start talking, maybe you should even start before you get pregnant?
Very correct. Prenatal vitamins have 400 micrograms of folic acid, and it's recommended that folic acid is taken even for women who don't intend to become pregnant in case an unintended pregnancy occurs. Folic acid is important in preventing neural tube defects such as spina bifida.
Oh, you know, I've heard, actually spending time with some of your other doctors, people referring to coming up with the birthing plan and actually seeing the facility and getting comfortable with the facility. How important is that, and what kind of things do you offer at Florida Hospital?
It's wonderful. We actually have a baby place folder that we give the patients around 30 or 35 weeks so that they can schedule an appointment to view the baby place as well as go into the prenatal classes and the childbirth classes.
And obviously you have a passion for it. So how can you, I was going to say, how do you want to try to make mothers at ease? Because again, we touched on it at the very beginning. It is kind of an intimidating kind of thing. So what are some words of advice out there to maybe ease some tensions and really show what Florida Hospital has to offer?
Well, the first thing is to just relax and enjoy the pregnancy. That's going to be the most important part. We want patients to not only understand that it's, yes, a medical procedure in the terms of delivering a baby, whether it's vaginal or by cesarean, but to enjoy being pregnant and to enjoy the childbirth process is very important.
You know, we talked a little bit about nutrition with the prenatal vitamins and things. What about some nutrition tips, or what about even exercise tips? I mean, I know that can kind of factor a pregnancy. Help us out here.
Definitely. Evaluating your diet can be daunting with all of the things that are coming out. Everybody wants farm to table and things of that nature. But the U.S. Department of Agriculture has a wonderful website called ChooseMyPlate.com, and it can help you to make very good food choices. Now, as far as exercise, we still recommend 150 minutes of moderate exercise daily prior to pregnancy. And generally, if the patient does not have a medical condition or pregnancy-related condition that prohibits them from exercising, we want them to continue that. Swimming, walking, modified yoga, modified Pilates, they're all fantastic for keeping her blood pressure good, keeping the pelvic muscles ready for delivery.
That's what I was going to say. So you do find out you are pregnant. You know, do you stop all of these things? Then do you have to try to make the changes? You're saying do them.
We want you to continue.
And what are some of the other ways, though, that you guys have really tried to embrace? I mean, we've got this segment called Little Inspirations, and we're really trying to welcome mothers into the Florida Hospital. What are some of the other things that may be unique that you can offer mothers and their babies?
Well, most hospitals now do have labor delivery recovery rooms, but we have our nurses who are very well skilled in bringing the baby right to the mother so that we can go ahead and start the baby on the chest, as well as breastfeeding help.
So it sounds like you guys have it all figured out.
Just about. We just need the people to come with the babies.
Need the people to come with the babies, or even pre-babies like we just touched on.
Correct.
And again, so any advice, it sounds like no matter what, if you're thinking about it, go ahead and start to find a doctor like yourself.
Correct.
Sooner rather than later.
Sooner rather than later. Those prenatal vitamins are paramount. And just to discuss your history, things that are in people's medical history they may not consider important when it comes to having a baby, whether they had a previous cesarean delivery, whether there's even a genetic issue on the father's side of the family.
Oh yeah, because normally you always think of the mother's side of things.
Correct, but daddy gives 50%.
Oh, that's what I hear. That's what I hear. Well, thank you so much. Is there anything else that you would like to add about the Little Inspiration segment? We're actually kicking it off here.
Well, I'm just proud to be a part of it, and we want to continue to provide great care and inspired health through Florida Hospital.
Well, thank you so much. We're very excited to have you here today.
Thank you.
Pleasure to meet you. And for more information on pre-pregnancy health and planning and Little Inspirations, just log on to littleinspirations.org.